Okay, so just to begin, I started this thinking process for doing this workshop about a year ago. I was up in Boston, and I stopped by and talked to Anna Moon and Aaron and said, we've got these several very large regulations coming up. Wouldn't it be great if we could figure out a way to do some research to figure out whether they're actually going to have the effect we think they're going to have? And Aaron said, well, we've had a lot of these workshops. I'm not sure that another one's going to be that helpful. So I still felt it was, so I started really pushing around a lot, and eventually I got my way, and now we're having a workshop. But so I'm hoping that this is an opportunity that we can take to really look forward and also look backwards and ask questions about how well we've done in assessing previous regulations and looking at previous interventions, but also look forward and ask the question, can we do better? Can we do better in designing research and collecting data and actually measuring the outcomes of interest? But again, I thank you all for being here, and I do hope it's a productive meeting. This is the relatively large planning committee we had for this workshop. Again, my original idea was to get maybe 10 or 15 people together, and it's obviously grown from there. But this really helped within EPA. We had several offices represented with the Office of Research and Development and the Office of Air and Radiation, and folks from CDC and HEI. So why are we doing this workshop? All three organizations, EPA, CDC, and HEI, are planning for future research on accountability in different ways. But fundamentally, each organization wants to assess to what extent are EPA's regulatory programs decreasing ambient air pollution and improving public health. And to answer this question, this workshop is centered around two fundamental questions, one of which is, what are the limits that we see in observational research in addressing questions related to air quality and health outcomes? And then second, understanding those limitations, what research questions related to air quality and health outcomes can be best addressed with observational research. And that's really what we're talking about today, is looking out using the standard epidemiological tools, what can we do with observational data? The other point I wanted to make is that we have a relatively unique opportunity. We had an opportunity back after 2005 when we had the suite of clean air regulations that came out in 2004 and 2005, and those were a series of regulations on diesel engines, as well as the Clean Air Interstate Rule looking at transport of SO2 and NOx. And we had an opportunity then, and we sort of missed that first opportunity, and air quality has really improved from 2005 until now. But we still have another opportunity. We have several other large regulations. We have the mercury and air toxic standards, as well as the additional impacts associated with the cross-state air pollution rule, or whichever rule ends up replacing that. And we also have several mobile source regulations that have not been fully implemented and aren't expected to be fully implemented until 2020 or beyond. So there's still an opportunity to look at substantial reductions in air pollution and improvements in air quality, and it's an opportunity for us to still look forward and ask the question, can we do a better job or a more effective job in assessing how well these regulations are working? This builds on recommendations from recent HEI and also a report from NARSTO on accountability research. And I just repeat two of the recommendations here, one from HEI, which was to say that we should anticipate and prepare for major upcoming regulatory actions at national and state levels. And that's part of what this workshop is trying to do, is just begin that process of anticipation. And then the NARSTO report said that a complete accountability program that links sources to effects requires advanced planning to ensure that the necessary methods and data will be available to provide the level of proof desired. And that last statement is important, the level of proof desired. What is it that we need to be able to say with enough confidence that a regulation is having the impact that we want on air quality and public health? And then finally, this opportunity through this workshop leverages ongoing research that's already being supported by EPA, CDC, and HEI, some of which we'll talk about as we go through the day. So I'm not going to go through this in detail, but I wanted you to see that this is not a workshop that happened all by itself, that is standing alone. In fact, there's a long history of workshops and communications and other types of activities that have occurred over the last decade that have focused on accountability and outcomes research. And again, the most recent of these two were an HEI workshop in 2009, which highlighted research that was ongoing and planned to assess the health impacts of actions taken to improve air quality. And the NARSTO report, which just came out last year, the technical challenges of multi-pollutant air quality management, which also included a substantial amount of of writing on how to do outcomes research in a multi-pollutant framework. So we're building on that, and again, we're not trying to start something new. What we're trying to do is figure out ways to take us into the next round of research. So what are the types of policy questions that might be informed by accountability research? And it's always important to know what kind of question you're trying to answer before you start the research. Sometimes I think because of the fact that we're using data that's collected for other purposes, sometimes we find ourselves looking for questions to match the data that's available. But we thought it would be useful to make sure we understand what questions we're trying to answer. So looking forward, we say to ourselves, do we want to continue to target overall PM2.5 reductions, or should we focus our reduction on certain components? For example, we've reduced a huge amount of sulfates in the atmosphere. Is this something we want to continue to focus on, or do we want to focus on other specific components or sources? Are reductions in multiple pollutants having a more or less than additive effect in reducing health outcomes? We're meeting multiple standards on similar time frames, and we really have still not engaged in enough research to understand whether those pollutants are acting together in ways that are more than additive. Is there a continuing proportional relationship between reductions in emissions and reductions in ambient air quality and health outcomes? We've seen a linear or almost linear relationship between reductions in air pollution and changes in mortality and morbidity. And the question is, will this continue as we go to lower levels? What is the impact of regulatory changes over time in the composition of PM and mixtures with PM and gases and its role on observed health effects? Again, we're changing not only levels of air pollution, but the composition of air pollution in different locations. What are the role of other factors? For example, socioeconomic status and existing health conditions in modifying the impact of air pollution interventions over time. We've seen an incredible increase in the use of statins, and that may be affecting the cardiovascular response of air pollution, but we won't know unless we actually formally research to specifically look at those questions. Have regional regulations been effective in reducing health impacts in urban population centers? Have they also addressed health impacts in rural locations? Again, it's not just the levels of air pollution, but the distribution of air pollution over different parts of the country that have changed. And finally, are there other important regional impacts of air pollution regulations that suggest the need for more local or regional approaches in addition to national programs? And again, we've seen several national programs such as the Cross-State Air Pollution Rule and the Mercury and Air Toxic Standards. And the question is, are those sufficient to bring down levels of air pollution, or are more local programs needed? And I'm sure there are many other questions as well, but this is, as you can see, already we have a list that is fairly substantial and would take a great deal of research to look into. And again, thinking about it ahead of time allows us to be able to ask the questions of which of these questions are most readily answered by the use of observational data. So the question that we started with is, are we ready? Is this the time to do this workshop? Is it the time to do this research? And clearly, researchers funded by EPA and HEI and CDC have made progress in assessing short-term interventions. There's been a lot of research on shorter-term interventions, shutdowns of plants, looking at happenstance interventions like the Olympics. So I think that that information and that research that's already been done is very informative. We have a reasonable understanding of the expected improvements in air quality that I think are going to be coming from air quality regulations affecting power plants and mobile sources, and Neil Pham will give you a sense of that a little bit later in his white paper. New statistical methods are becoming available to help us understand causal pathways for complex interventions that affect emissions from many different sources and differentially affect air quality in many different locations. And this will be talked about by Corey Ziegler later on. And opportunities do exist for better measurement of air quality changes in the health outcomes. This is not something that we can't do. So we do believe that we are ready. And then the question comes, are we too late? Has too much happened already for us to be able to look forward and getting meaningful signal moving forward? And the answer there is perhaps. Air quality has improved dramatically already over the last 20 years. And many locations in the U.S. are already below 12 micrograms in terms of PM2.5 levels. That's our new current standard. And between 1990 and 2010, SO2 emissions have already dropped by over 70%. So there's been an enormous improvement that's already occurred. However, based on recent data, 66 counties are still above either or both of the current PM standards, and 46 areas covering 227 counties don't meet the 8-hour ozone standard. So there's still a great deal of locations in the U.S. where air quality is not considered to be at a protective level. EPA is still implementing a number of our programs, so we still expect there to be reductions in emissions. Again, the mercury and air toxic standards is expected to get substantial additional reductions in SO2, and several of our mobile source programs affecting both the gasoline and diesel fleets are not going to be fully implemented until the fleets turn over, and that won't occur until after 2020. And then finally, a recent study, again, by some of the folks who are at our meeting today, was able to detect an impact on life expectancy, in this case around the order of 0.7 months, from only an average of 1.6 micrograms change in PM2.5, similar to what is expected from our future regulations. So it is possible to detect this type of signal, at least in a large-scale national study. So the answer is no, it's not too late, but I don't think we have much time to waste putting together a research plan. If we want to do this and be able to really look at these regulations as they come into place, we need to put in place measures of baseline emissions, air quality, and health data now. And this is just showing you, just to provide some context, this is showing you the 8-hour non-attainment areas for the 2008 standard. And again, you can see that it's still pretty widespread across the country. They're not all equally out of attainment, but there is a number of areas that are out of attainment. And then this is the set of counties that are above the 12 microgram standard based on recent data. Again, for future projected data, Neil's going to talk about that later, but currently, today, this is where counties exceed the new 12 microgram standard. And then these are, again, just repeating the key questions that are the focus of the panels. The two questions I mentioned earlier, and then we have 4 panels. Panel 1 is going to be talking about how we can use existing air quality and health data to perform meaningful outcome research. Panel 2 is how can we effectively utilize data from existing health data sources and air quality monitoring networks, and how can we capitalize on future health and air data sources, such as special purpose monitoring proposals. The third panel will discuss what health data are currently available and how we can maximize the use of that existing health data. And the final panel will be focused on what current and new statistical and study design approaches we could employ to strengthen our ability to assess relationships between changes in emissions and air quality and changes in human health outcomes. And the way the day is going to be structured is a series of these panel discussions that will be introduced with a summary of a white paper that's focused on the topic. We'll then have our panelists provide remarks based on these questions and on a series of discussion questions that we develop for them to begin thinking about. There will be a 30-minute public discussion session after the morning panels, and then there'll be a longer discussion, 45 minutes to an hour discussion at the end of the day for public discussion as well. After each panel discussion, we'll have an opportunity for maybe 1 or 2 questions from the audience, but we'd ask that for the longer discussion and the more broader discussions, we wait until the public discussion period. A reminder that this is being simulcast with a webinar. So we're going to ask that when you ask a question, you ask it to the microphone, and folks will be, I believe, passing around the microphone unless people come up to the microphone